you, everybody, for coming. We still have a minute or so. I'll just kind of hang out here and talk till as people continue to come in. So my name is Rick Welsh, and I'm chair of the Nutrition and Food Studies Department and a professor of food studies. Our department has a number of programs. We have bachelor's degrees in nutrition and dietetics, nutrition science, and food studies. We have an MA and an MS in nutrition science and an MS in food studies. We obviously work on issues of food security, food access, sustainability, a number of other topics. We brought together a panel today made up mostly, but not entirely, of our faculty, parts of our faculty, and one of our alums who's gone on to become the food service director for Syracuse City School District. And I haven't officially started. I'm sort of just getting warmed up here. So, but before I actually get going, I would like to read a statement that we read here at Syracuse University and Falk College before large events. And that is that Syracuse University and Falk College acknowledge with respect the Onondaga Nation, firekeepers of the Haudenosaunee, the indigenous peoples on whose ancestral land Syracuse University now stands. We do that to honor the indigenous peoples in our area. Moving forward, we have an excellent panel today. I will keep my remarks brief so that we can focus on the substantive issues. Before I introduce the panelists, I would like to thank Dr. Margaret Voss, who's an excellent researcher and teacher in her own right, who is handling the technical aspects of this. So she's a Renaissance woman, and she's done an amazing job, and we're very, very grateful. So the way that our agenda is designed is that first we will have Dr. Ann Bellows, who's the graduate program director in food studies and a professor of food studies, who will give an overview in her specialty area of research. Scholarship is the human right to adequate food and nutrition. That'll be the framework under which the rest of the panelists will offer their remarks, experiences, and research that they've done. We will then go to Ms. Chayeli Charles, who is an assistant teaching professor in nutrition science and dietetics, works on a number of issues, including nutrition and anti-hunger issues around the elderly. Ms. Rachel Murphy, who is the director of the Food and Nutrition Services at Syracuse City School District, and as I said before, one of our alums from the nutrition program. And then our final panelist is Dr. Laura Ann Minkoff-Zern, who is an associate professor of food studies and the undergraduate director for food studies, and who's done a tremendous amount of wonderful scholarship on food worker rights, especially farm worker rights, and issues around hunger and food access. Okay, so I will. Okay, I'm looking at some chat. We are going to hold questions at the end, to the end. Hopefully we'll have time for some questions. We anticipate that we will. We would like you, the audience, to post your questions to chat as you think of them, and then we will review them and ask as many as we can at the end after the panelists have presented. Okay, so at this point, I would like to introduce, or turn it over to, since I've already introduced, Dr. Ann Bellows to provide the framework on the human right to adequate food and nutrition. Thank you. You're muted, Annie.
Okay, so thank you, Rick. First technical glitch, unmute. Welcome everyone. It's a pleasure to have you all with us. In this first slide, we recognize a context where the right to free speech serves as the avenue to articulate the violation of civil and political rights. These are familiar legal rights enshrined in the 1779 Bill of Rights and subsequent amendments. They do not guarantee justice, but we know when our rights are violated, and we have recognized means of recourse, be they judicial, administrative, political, or social protests. Next slide. In 1944, despite national distrust of Soviet socialism, US President Franklin Roosevelt introduced a second Bill of Rights to establish, quote, a new basis for security and prosperity for all, regardless of station, race, or creed, and including the right to a useful and remunerative job, the right to earn enough to provide adequate food and clothing and recreation, the right of every farmer to raise and sell products at a return, which will provide the family a decent living. Except for Social Security and unemployment insurance, Roosevelt's second Bill of Rights was not successful in the US. Next slide. For the world, however, FDR helped frame the Universal Declaration of Human Rights that encompasses civil, political, economic, social, and cultural rights, and serves as a foundation for the United Nations international declarations and binding treaties, including the human right to adequate food. Next slide. Recently in the US, we see public discourse growing that embraces group rights in addition to individual rights, being for indigenous, women, migrants, farmers, differently abled, LGBTQ, seniors, children, and communities, and also for economic rights like food, health, housing, education, and child care. Next slide. The human rights-based approach to food and nutrition justice is not defined by food security, although it incorporates it, but rather by a healthy, sustainable, and inclusive food system that nurtures all. Human rights are defined and protected by law. Governments carry legal obligations to progressively realize human rights, that is, to constantly improve rights. And this requires monitoring policy implementation, modifying plans accordingly, funding to the extent possible, providing mechanisms for rights holders to seek recourse and remedy for violations, and evolving human rights as living law to constantly advance human dignity and inclusion. In all of these stages, human rights law mandates civil society participation, most especially by those who experience violation. Further obligations include that the government has the obligation to respect human rights, not by not interfering with what works. That might, for example, include not permitting oil pipelines across pristine habitat that support indigenous food sovereignty through cultivation, foraging, and spiritual uses. The government has the obligation to protect human rights by regulating non-governmental interference with what works. This is grounds to consider prohibition of junk food marketing in public schools, or as we see here, regulation of an industrial scale meat provider recently found pressuring low-wage meat company employees to work in unsafe COVID-invested factories. And finally, the government has a three-part obligation to fulfill human rights. The government facilitates the right to food and nutrition by helping people and communities help themselves, different from food security alone. The slide shows the insignia of the Detroit Black Community Food Security Network that works to promote strong community values and a vibrant local food economy. The government has the obligation to promote right to food and nutrition by teaching and educating human rights. And finally, the government provides social protections for those unable to help themselves in emergency and chronic situations. Food relief is critical, and yet it's only one part of the human right to adequate food and nutrition. The COVID crisis reveals the depths of economic insecurity, discrimination, and poverty, how we are stuck by the limits of a Band-Aid approach with food relief. We need a food system and community-based approach to food and nutrition justice while still attending people in immediate need. A human rights-based approach to food and nutrition is already engaged in many other countries. Let's catch up. Thank you.
Okay, thank you, Ani. That was excellent. At this point, we'll shift over to Rachel Murphy, who's again the director of the Syracuse City School, Syracuse City District, Syracuse School Food Service. Thank you.
Thank you, Dr. Welsh, fellow speakers, and all those who are joining us today. As already mentioned, I'm Director of Food Nutrition Service for Syracuse City School District, a high-needs urban district of approximately 21,000 enrolled students. And we participate in multiple trial nutrition programs, including National School Lunch Program, School Breakfast Program, the Child and Adult Care Feeding Program, and some others. Syracuse has more than its fair share of needs. In 2019, we were actually ranked the highest rate of poverty in New York State among all cities with populations over 65,000. This is a pervasive factor impacting the very fabric of the Syracuse community at large. Our student body is also very diverse and economically disadvantaged, with 81.72% qualifying for free reduced meal service. And unfortunately, within any given school year, about 10% of our students are homeless. So as such, Syracuse qualifies for the community eligibility provision. And for those of you who aren't familiar with that, it's a meal service option that's ran by the U.S. Department of Agriculture. Under this provision, schools with over 40% of enrolled students that qualify for free meal service can be offered meals to all students at no cost. At the end of the day, what this means for the children coming in every day to the cafes, everybody receives free meals, free breakfast, free lunch, snack, whatever is offered in our school system regarding food, it's free. The benefit of providing children of low-income, impoverished families close to 50% of their daily nutrient needs free of cost assists in ameliorating hunger, food insecurity, and health disparities while improving school performance. Free student meals immensely benefits our families whom experience high levels of concentrated poverty, as already mentioned, and the compounding risk factors, including a slew of things such as illiteracy, unemployment, violence, incarceration. Really, the list in Syracuse goes on, and there really isn't a time that you can't see something on the news which highlights any of these factors. All of this negatively impacts our children, and as if that wasn't enough, unfortunately, access to food is a pervasive problem in Syracuse, with more than half the census tracts being classified as food deserts, which further intensifies food insecurity in our mid-sized urban city, Syracuse, New York. Thank you, Mr. Welsh.
Thank you. And I will say that I neglected to mention that we have a series of 4 questions that I'm asking the panelists, and they'll each take them in turn. So that was my fault. The first question is, describe the food security issues related to the community, your community that you serve prior to the onset of COVID-19. And so that's exactly what Rachel just did. So now with the same question is posed to Chaya Charles.
Thank you. And so the group that I mostly work with is the aging adults, so senior programs in the central New York area. And pre-COVID in the US, we saw 5.3 million seniors meet the category of food insecure, and 2 million seniors have very low food insecurity. So over the past 2 decades, the fraction of these have increased by 38% and 94% respectively. So this was an issue even pre-COVID. Food insecurity among the younger demographic actually is showing a high. The 50 to 59-year-old age range has 10.6% of that population, US population food insecure, and a little over 4% with very low food security. So these are higher numbers than the over 60 category. The trend is still higher in over 60, but the total numbers are higher in this younger group. Younger seniors, when you look at the age groups by 60 to 70, 70 to 80 and above, the younger seniors tend to be more food insecure. One of these reasons is that as our population ages, they tend to enter into institutionalized living situations, assisted living, long-term care facilities, in which at least a majority of their meal service is provided to them as part of the room and board. And so it's the younger demographic who has food insecurity, but is not in a health state that they need some type of assisted living. There are higher prevalences in those who are from racial or ethnic minorities. Caucasian seniors have food insecurity rates that are less than half the rates of African American and Hispanic seniors. Disabled, people who are disabled have highest rates of food insecurity over those who are unemployed but not disabled, and significantly higher than those who are employed or retired. New this year, the USDA in their survey categorized disability also if the senior reported any issues with hearing, visual, cognitive, ambulatory, self-care, or any independent living difficulty. And this was important because it may not be a diagnosed disability in terms of they receive a disability check, but it certainly is a disability when we're looking in terms of the ability to make themselves food secure. So in this, we're looking more at cognitive and skill reasons that are making someone food insecure, not just the financial component of it. And when you look at these types of disabilities, food insecurity rates are more than twice that of those who do not, twice to up to 3 times higher than those who do not declare those disabilities. Also, when we look at renters versus homeowners, renters have a higher prevalence of food insecurity. This could be related strictly to income status in that people who have higher incomes tend to be the group that owns homes, but it also could be in actual expenditures and money going out per month, and that a lot of older adults who own a home may no longer have a mortgage that they're paying on a monthly basis. And so the monthly amount of money they're having to go out for their home is not necessarily there, whereas renters, it's a constant monthly expense. Some other things of note would be marital status. Those who are divorced or separated actually have the highest prevalence of food insecurity. But an interesting is that those who are widowed have double the rate of food insecurity of those who are still married. And I've seen this in practice very commonly from usually one of 2 reasons. One that I commonly see is that the person may have been the sole meal preparer for their entire lives, and they're used to cooking for their family and their spouse, and now if they're living alone, there's an actual sadness and emotional connection that they're feeling when they're not cooking for a bunch of people around them. And so they would rather not cook than just cook for themselves. The other side of that I see, and I typically have seen this more in men, is that they may have never been involved in any type of meal planning, purchasing, preparation before. That may have always been their spouse's area. And so now they're 70, 75, 80 years old, and all of a sudden newly having to figure out a way to nutritionally meal plan. So there might be some learning needs there. In terms of rural areas are more impacted when we look at senior hunger than metropolitan areas, which I think is surprising to a lot of people. Rural areas tend to have about 4% higher food insecurity than urban areas. And when you think of food deserts, we often think about that in terms of cities. And food desert definition is when there is not an adequate nutritional food source within a mile in an urban area. When we switch that to rural areas, you're talking about a 10-mile distance. And it may not be that there is only a corner store. There may literally be no source of food within a 10-mile distance. And so if you have transportation limitations, your food access is severely limited. And then nutrition assistance programs tend to be underutilized in this population. Nationally, only 42% of eligible households participate in SNAP. In New York, we see roughly 5% more participation in urban areas than in rural areas. In the county that I work with, we see 14 to 15% of our households participating in SNAP. Common reasons that I hear of why people are not participating is that it's too cumbersome to apply, they don't think they would qualify, they don't think the benefit is worth all of the effort. So as healthcare practitioners and as community organizations, we really need to be promoting participation in these programs, because even if it is a small amount of money, it may be enough to get somebody through that gap of when their money is running out to the end of the month. Thank you.
Okay, thank you, Chea. And now we'll move on to Laura Ann, Dr. Minkoff-Zern.
Thank you, Rick, and thanks to all the presenters and to Margaret and Lynn Brand, who did a lot of work to organize this. So I'm speaking about food insecurity. As a researcher and a scholar, I look at labor across the food chain. And what we see is that people that work across the food chain, and so that includes people that work in the fields, farm workers, as well as transportation workers, the processing workers, like the meat plants that we've heard so much about in the news, as well as mentioned by Dr. Bellows before, as well as service workers, so people working in restaurants. So those are all the different people that I look at across the food chain. And so there's been a real move to start understanding labor issues as food system issues rather than looking at each of those sectors individually. And unfortunately, when we look at labor across the food chain, what we see is that most people working in food production, food service, and food processing actually live and work at wages that are below the poverty line, which of course is very related to food insecurity. So a report by the Food Chain Workers Alliance showed us that more than 86% of food chain workers earn low or poverty wages. That food system workers use food stamps and other food assistance at double the rate of the US workforce. And so also remember that people working in, large chain grocery stores are included in this. So we know that stores like Walmart are notorious for even offering food stamp applications to people when they start working at their stores, and that stores like Walmart are sell some of the highest rates of groceries as compared to other stores like smaller grocery stores in the country. Specifically farm workers, which is who I've done most of my research with, tend to be up towards 50% food insecure, and that's based on my own work as well as studies of others across the country. And I think it's really important to note, especially in this moment that we're in, talking a lot more about systemic racism as it relates to poverty, is that, of course, workers of color, as well as women that work in the food system, are much more likely to be in these insecure positions that are part-time, where they're making a minimum wage or even under the minimum wage if they're making a tipped wage. And so there's several studies that have come out looking at the relationship between race and labor in the food system. And of course, the lower your wages, the more vulnerable you are to food insecurity. And also in the particular moment of COVID, what we've seen is rather than recommendations and structural change being put forward to solve some of these problems, especially as we are seeing these workers being identified as essential workers. They're still going to work, of course, because we all need food. What we've seen is actually moves to lower worker pay. So the White House explicitly called to lower farm worker pay in this time, which would, of course, increase food insecurity among those workers. And as far as how significant this population is in terms of the overall population, 14% of our workforce in the United States is employed in some part of the food chain, which is over 1 in 7 workers in the US. So if you think about that in the context of how many of those workers are living in poverty and experiencing food insecurity, we see that this is a really huge problem. So I would just point to this huge irony that food workers, particularly people that are growing our food and processing our food, are food insecure themselves. So on the second half of my slide, it says, "This is a salad bowl, the nation and people are starving." And that was a quote that I heard doing my dissertation work in California at a food bank in California that primarily serves farm workers. So yeah, I'll end there and look forward to answering the future questions. Thank you.
Okay, thank you very much. Now to all the panelists, but now we'll move on to the next question, which is, how has the COVID-19 pandemic affected food security in the community that you serve? And then within that answer, can you distinguish between shorter and longer term effects? So we'll begin again with Rachel.
Absolutely, thank you. The initial impact of COVID-19 was immediate, and I think we can all agree it certainly didn't creep up. It came with a boom. And in a community with over 80% of the students qualifying for free or reduced lunch, our operation transitioned overnight into an emergency food program. Congregate feeding and offer versus serve meal models disappeared. More than rising to the occasion was our essential workers, our frontline staff, food service helpers. They rolled out a new grab-and-go meal model service, and as the new essential frontline staff, they worked tirelessly in production and at points of service, which were new and somewhat innovative from what we had been doing. They're directly interacting with students and families at over 30 feeding sites. We placed staff into a rotating schedule so that we operated at any given time with 50% labor. And we did that because we were very concerned on how we would navigate an internal outbreak should it happen. To date, we provided over 500,000 meals, and that is attributed directly to our food service helpers who have been integral to meet the basic needs of the community at large. Another immediate and massive change came with us with use of our facilities. Traditional operations through the classic cafe lunchroom morphed into curbside. We identified locations on school exteriors that could function much like a fast food window that you would see through takeout. We utilized double door pass-throughs, school buses. Really, there was nothing that we didn't try to pursue to decrease points of contact with our families that we served. And it went through, as we did this, the facilities department, they went through immediate shutdown for cleaning and restricted access in all buildings. So it really changed how we operated. Equipment moves to enable safe food operations at new points of service were done. We established social distancing cues as food lines formed during a service that came with additional CDC guidance that was rolling out as the epidemic went on. And I really can't say enough good about the other programs we work with, security and facilities department, that really helped to make it all happen. In light of all this, anyone who has bought toilet paper during the pandemic can attest to changes in purchasing. Specifically, food supply chain was immensely disrupted. And with boundaries closed, the restaurants upended, lack of workers, transportation disruptions, the food chain has been squeezed quite a bit, and it affected our procurement operations on all levels. We've seen and heard of fluid milk getting poured down the sewer lines as farmers struggled to shift processing for new retail outlets. And the school food authorities, not just with us, but with all school food authorities, the price changes followed suit with a lack of product that we needed that was not even accessible. And balloon prices, we don't expect those to deflate post-COVID. We know that long-term impacts are going to continue as vendors are looking to make up for losses. That, paired with our own loss in revenue while still floating a full overhead cost, will lead to financial struggle within our program. Though it's not going to just continue for a few months, I anticipate that this will be going on for quite some time. Normally, we receive government reimbursements for every meal served. And because of the shutdown, even though we are still serving quite a bit of food and setting out meals to the community, a normal school year will generate about 27,000 meals a day in Syracuse City School District, which is a stark contrast to our current service, which is averaging about 9,000 meals a day. So the loss in revenue is really going to continue to hit hard as the months go on. Additional revenue losses from a la carte sales, catering service, and food service contracts with outside agencies, which have been completely shut down, that's also going to be a pain. We expect to feel the financial burn in months to come, which will certainly impact what we menu for the fall of 2020. And I guess I would be remiss not to say if there is a fall of 2020 for the opening of schools, and what that will look like, we don't even really know. But what we do know is that when school does reopen, we may be in a completely different meal model service than anything we've ever really done before. Syracuse is looking at many options, including pre-plated services and eliminating offer versus serve for elementary ages, looking at alternate dining locations to accommodate smaller groups for children. It's really going to be a new menu, new products, new recipes, all folded together to create a new food service operation that we potentially might be using for the long haul.
That was excellent. Thank you so much. Very informative. We'll move on to Chaya Charles.
Thank you. So I broke this up looking at kind of the last 90 days and the next 90 days and beyond. So because we work with seniors, there's been a lot of controversy of, quarantining and should we just do herd immunity, and whatever side you are on those debates. The one thing that really has not been debated is that seniors are the most at-risk population for serious health consequences from this virus. And so that was our concern going into this, is how do we still reach all the seniors that we need to in a way that is safe and that we are preventing as much as possible any virus transmission. We saw fear in our seniors of consuming food that we were bringing in from outside the home, fear of entering grocery stores, deservedly so. I also saw we had increased food waste because people would bring them food and they didn't trust that it was safe and they were worried that somehow they were going to get the virus from it and they were throwing it away. And these are people who are food insecure. And so there was a lot of different things coming in at the same time. So logistically, our biggest struggle, well, one of the first struggles was that we needed PPE. We needed protective equipment for our staff. We needed gloves, we needed masks, we needed shields, we needed sanitizer to be able to still function in a safe way. And aside from funding issues, 63% of Meals on Wheels programs nationally reported their biggest challenge of being able to obtain this personal protective equipment for their staff. We also had concerns about volunteers. Our program is 60% volunteers that deliver our foods. And so if our volunteers go away, we cannot provide food to 60% of our clients. A large portion of our volunteers are seniors. And so how do we protect our volunteer seniors who are delivering to seniors and that entire situation? How do we deliver meals still and socially distance? So we created plans where we hung meals on door handles or had a spot that we designated with the client of where we would keep the meals. This was in complete contrast to our normal procedures in which we mandate actually that the drivers hand deliver meals so that we don't have meals laying on porches and such for extended periods of time. So it took a lot of training. Our congregate senior centers, where normally people would come together and have lunch together, actually converted to drive-through operations in which we had the center manager that had the pre-made food, and we were doing like kind of batch food at that time. So we weren't coming in contact with the seniors every day. So we were providing them enough meals for a few days at a time to decrease that interaction. Also pantry items, commodity supplemental food program changes. Typically our drivers or our delivery people would see if the person had other needs besides the home delivered meals we were giving them. So if they put a meal in the refrigerator and they saw the only other thing in there was a bottle of mustard, they would come back and say, I think this person needs some additional assistance, and we could figure out a pantry box and get some additional food to them. So how would we identify that? The way that we did it was that we cold called our clients and said, how are you? What else can we help you with? What other things do you need? There was absolutely an increased demand. 4 out of 5 Meals on Wheels programs actually doubled their participation, some increasing as much as 900% in their new requests for meals. Our program had a 35% increase, so we went from a little under 1,000 meals a day to a high of 1,300 meals per day a few weeks ago. We also had newly food insecure people, especially that younger demographic who maybe lost their job due to the COVID crisis and now we're newly food insecure. And so they kind of lacked those coping skills that long-term food insecure people have of how to get through the month, how to apply for the programs. Those already on SNAP automatically got the increased benefits, but how does somebody navigate the system who is initiating new benefits during a pandemic when the offices are closed? For a lot of people, that answer was to go to the online format. However, in this demographic, we also see that not everybody is tech savvy and comfortable with the online environment. So this new virtual reality that we're all currently living in right now is not necessarily the reality that some people can live in. So although technology rates in seniors are rising and we're seeing a narrowing of that digital divide, still only roughly 1/3 of seniors do not use the internet. And though they're the fastest growing group of Facebook users, still only 30% use social media. Less than half own a smartphone. In rural areas, even our local internet provider that was providing free service does not deliver to rural areas. And you say, oh, well, then use your cell phone. Well, cell phone reception in some rural areas is not dependable. And so we tend to take for granted that this is an option for everybody. And specifically dealing with seniors, this is not just something that you can take as a guarantee. So there was a lot of stress over that. Also, the social isolation piece is big. It leads to decreased intake, worsened nutritional status. The loneliness tends to lead to depression, tends to lead to decreased intake. And so going forward, our plan is really just to come up with a more sustainable solution. We had the emergency menu that we had to implement right away. And then we had to make changes and say, okay, it's not enough to just make sure that we're meeting the requirements. What do people need specifically at this time that we can make sure that we get them? We still want to be providing them with a high quality meal. Because of this, we need increased funding going forward. We expect that as people go back to work, we will have a decrease in some of the influx we saw, but it's going to be a bit of time before people are rehabilitated back. And it's also going to be, for the seniors, this isn't something that's going away until we have a vaccine or a treatment. They continue to be the most at-risk population, and we have to protect them. So we have to look at shifting the dependence on maybe some of those national food supply chain issues that the other speakers have talked about into more of a local utilization of resources. And that's something that we had to do during this crisis, was look at our local farmers who are struggling to get rid of their food. We're struggling to get food, and we were able to create those partnerships. So let's look at those partnerships and see if we can make them long-term. Thank you.
Thank you. Thank you very much. Now we'll move on to Dr. Minkoff-Zern.
Thanks. Yeah, I think what Chaya was saying about the vulnerability of kind of our food chain right now and people's growing awareness around that is a really good transition to talking about the food workers that are working at all the different levels of the food chain. So as far as short term, what's been going on with food workers in the context of the pandemic, as people I think have been hearing about, and many people for the first time, right, is understanding the working conditions that food workers are laboring under. And so the fact that food workers have no option under our current system but to work very close together, so whether that's in the field during harvest time, in the trucks that they use getting transportation from field to field, or in a meat packing plant, it's very difficult for them to social distance in their job as essential workers. And what we've seen is in that context, particularly as many of them being undocumented workers and workers of color, what we've seen is they're systematically not getting access to the PPE that other essential workers are being given. They're just not being prioritized by county governments. We also see that overall they don't have access to healthcare. They don't have sick leave. So if they're feeling unwell or sick, they don't get to stay home. And so what we're seeing is massive breakouts of COVID among food workers. And then when they can't go into work, there's no safety net for them. They're not going to get paid. And again, that's just increasing this vulnerability to food insecurity. As I mentioned, field and processing workers in particular are largely undocumented. So the National Agricultural Workers Survey estimates, and that's the federal survey by the Department of Labor, about 48, about half of the percent of our agricultural workers are undocumented, but anyone that works in the fields as an advocate or a researcher usually estimates closer to 80 or 90% of field workers. And so what does that mean for food insecurity? It means that even before COVID, they had very different access to nutrition support programs. So they don't have access to SNAP, they don't have access to things like welfare. So the larger safety net is not available to them. So they're already more dependent upon things like food banks and pantries, churches, soup kitchens, et cetera, those emergency food systems. And those sources, as have been mentioned, are incredibly overwhelmed right now. So it's already harder to get emergency food. And this is for a population that was already dependent upon emergency food, especially because of a language barrier, might not know of newer places to get food, also living in a rural area, as was mentioned, harder to have access to all these different resources and new forms of information. So the current systems that they're dependent upon are overwhelmed, and they are more likely now to be out of work due to illness or due to plant closures or farm closures. And again, back to that issue of kind of this the long-term issue we've had with the supply chain and the vulnerability. So while many farm workers are still going to the fields and still working, as we've also heard about, many farmers are plowing under their fields right now because they might be providing food to institutions like schools, like we've been talking about. And if those supply chains are breaking down, so is the work for farm workers. And there aren't a lot of other pathways and places for them to get work right now. So while some farm workers are still going to work, others are losing their jobs, and particularly in the meat processing plants we've been heard about, some of them are just being shut down temporarily. And again, there's nowhere else for these already economically vulnerable workers to go for an income. So as I said, supply chain disruption creates even more intense vulnerabilities for an already vulnerable group of workers. Again, as I mentioned, no access to things like unemployment benefits, undocumented workers don't get stimulus checks. So again, just increasing food insecurity among this population. And then finally, I just wanted to emphasize, again, and I'm going to bring this up in my final slides, but this irony that food workers are currently deemed essential, right? That they've been going to work all this time, yet many of them are undocumented, yet there is no current pathway to legal status or protection, both day to day when they drive back and forth to work or long term. And there was a great op-ed in the New York Times about this. And it's great. It's something that farm worker advocates have been talking about for a very long time, but what's wonderful is to see it in a place like the New York Times. That other people that are not aware of these inequalities in the food system are starting to really become aware of this. Right, so as long as we're talking about kind of a sustained path to food insecurity or food sovereignty or a human right to food, these more structural ways of looking at food security, we have to be dealing with all these other things that make this population more vulnerable, right? So undocumented workers and food workers overall began this crisis in a state of vulnerability, and what's going on is increasing their vulnerabilities at many different levels. Thank you.
Okay, that was amazing and depressing. So, but that's why we're here. So now let's move on to question number 3, which is what could have been done to improve the local, state, or federal government response to COVID-19 regarding the community with which you work? And again, we'll begin with Rachel Murphy.
Thank you, Rick. Well, I'll start with what was done for sure. The USDA granted states significant program flexibilities and contingencies to best serve participants across multiple nutrition programs. And I don't want to take away from that because I do applaud the efforts made. Then they were intended to ease program operations and protect the health of workers. However, they were significantly delayed and they lacked clarity in communicating waivers. The implementation became incredibly disjointed from one school district to the next. I'm highlighting here just many of the waivers. There are more than what is on this slide, but it just shows you that one waiver came out, there was another that came, and it was really a patchwork of waivers that was generated from the USDA. Within our community alone, our county alone, neighboring districts, they had vastly different interpretations of the COVID feeding operations, and that was due in part to all the waivers that came out. The public confusion ultimately resulted in creating barriers for families to navigate food resources that are available, even amongst providers. I did sit on a conference call with many other district directors to find out what was going on, and we were learning from each other the varied programs and how they were implemented. And I guess the irony of it is with such an overly regulated program, the child nutrition programs is just under constant scrutiny, and there's so many regulations that are attached to that. I really would have expected more direction when the waivers and the government response to the program, the COVID feeding program rolled out. I would have expected a lot more direction. Syracuse City School District, we did apply and receive approval for many of these waivers. Specifically, I want to point out some that I thought were wonderful, and I'll even say they should probably be ongoing into the coming school year. The nationwide mealtime waivers, it allowed us to let meals be served to kids outside of traditional meal times, and that was to encourage maximum flexibility for meal pickup. The other one I want to point out is a non-congregate feeding waiver. This allowed meals to be served in a non-group setting, which of course, if we were doing a group setting, that would directly oppose social distancing, which was a very strong, and it continues to be very strong guidance from the CDC and other authorities to continue social distancing. Another waiver was the parent guardian meal pickup waiver. Typically, we would only serve to a school-age child, but given the fact that these children are home, quarantined at home, whether self-quarantine or medically quarantined, we allowed folks, the government allowed us to have this waiver in place, allowing parents or guardians to pick up meals on behalf of the children that are in their home, which I thought was absolutely smart. Nationwide waivers of child nutrition monitoring. This was another one that came out, it came out late. We applied for it and we actually ended up doing all the monitoring and running around to make sure we did it. And then found out after the fact that we were approved to not have to do the monitoring. But the food nutrition service was provided flexibility for certain monitoring and reviewing requirements to be waived during the COVID feeding operations. And like I said, I don't want to take away the efforts that were made. I applaud them. There was absolutely a government response, but the clarity and the communication of it, the delay in it, it really seemed to be lacking. And I just wish it had been quite different.
Okay, thank you very much. Now we'll move on to Chaya Charles.
Thank you. And so looking at the government response in terms of senior meals going forward and what we really need to see to continue to happen over the next year, 5 years, 10 years. One of the big things is a decreased reliance on what we have is really a patchwork funding structure for senior meal programs at this point. The Older Americans Act of 1972 is what funded meals and other services to seniors, and we have not seen the funding keep pace with population growth or rates of inflation. You also see other nutrition assistance programs being more heavily funded than senior nutrition programs, and so really making sure that we are being equal with the senior programs is really important. Only 35% on average of senior nutrition programs funding comes from the federal government. All the rest of it comes from a mixture of state, local funds, grants, donations, private sector payments. And so it's really this patchwork that if one thing falls away, all of a sudden you're left with huge deficits in your budget. Private sector funding is especially difficult for rural programs in which you don't have a lot of really wealthy private sector corporations that can provide monies. And decreased funding means trade-offs in food quality, and inability to give the best quality food, menu selection or variety. I know in my program, you know, the service coordinator and myself, like we sit down and we do menu planning and it's, you know, hours and hours and hours long. And I want to say, I want to give everyone avocado because it's healthy and I want to give it to everybody. But the truth is that we can't afford things like that on the menu. And so we may want to, as dietitians, go the extra step and really be focusing on the nutritional aspects. But a lot of times the funding just isn't there for us to be able to do it. So looking at that, it also impacts variety, the number of days that some programs are able to offer. Some programs can only afford to offer 5 days worth of meals instead of 7. Others have to keep waiting lists for clients because they simply don't have the funding to provide more meals at the time. And in terms of the COVID crisis, and if we were to have a second wave and going forward, we need to be able to make sure that our emergency menus are still nutritionally adequate, like I talked about before. We also need to look at extending the emergency SNAP provisions that came through as part of the Family First Coronavirus Response Act. In this, it increased the allotment for SNAP participants to the maximum benefit. It also accepted telephone applications and created an online platform to help utilize SNAP cards for online groceries, or EBT cards through the SNAP program for online grocery sales. Right now, that is not a mechanism that is in place in every state that you can do online grocery delivery using your SNAP benefit. And so if somebody is using SNAP, then that is not a potential service for them. So looking at that, the average benefit to seniors nationally is $125 a month. The average benefit in New York is $179 a month. Typically about 20% of households with elderly actually receive the minimum benefit, which is $16 of SNAP a month. And so that is not enough to provide a nutritionally adequate menu, even for 1 week, let alone for an entire month. In my experience, many seniors in our area are receiving that minimum benefit. And so continuing with the extended benefit that bumps it up to a higher rate is really crucial in making sure we're meeting the nutritional needs of this population. It would help increase and improve the diet quality, allowing for more fresh foods. It also then would help support the local farmers. Studies have shown that for every SNAP dollar that is spent, it generates almost $1.80 in local economic activity, which helps create jobs and then expand the markets for farmers. So looking at that, making sure that the dollar value of the SNAP benefits is adequate to meet the dietary needs of seniors. Another way would be to increase the benefits for the Senior Farmers Market nutrition program. Currently, that program provides anywhere from $20 to $50 in annual vouchers. Increasing that would also allow for more purchasing of fresh fruits and vegetables, which we as nutritionists are encouraging our population to do, but they might not have the financial ability to do that. And then finally, just viewing food assistance programs in general for the elderly as a direct healthcare issue. A lot of times, these programs are looked in more of the kind of social welfare category. And although they do fit under that, for seniors, this is a direct correlation to healthcare. This is not necessarily a social welfare as much as it is a preventative medicine issue, right? So there's a cascade of negative health effects that comes from malnutrition that is a result of food insecurity, including worsening of comorbid diseases, diabetes, weight loss, malnutrition, muscle loss, increased risk of fractures, increased risk of falls, increased hospitalizations. All of this cascade that happens because of food insecurity in our seniors, and then we're paying for it in the healthcare aspect instead of paying for it preventatively in a food assistance. You can actually provide meals to a senior for the entire year for the same cost of being in the hospital for 1 day or being in a nursing home for 10 days. And so that's a pretty good trade-off, I think, if we can just allocate the resources a little bit more in the front end than waiting for the bad negative impacts of that afterwards. Thank you.
Okay, thank you very much. Now we'll move on to Laura Ann.
So unfortunately, I can't say that much has been done already. I do have ideas and recommendations for things that I think should be done and campaigns that have been waged over the past several years, and ideas that are very much in motion. So as I think I've been talking about, the relationship between food insecurity, and low wages is a direct correlation. We can't really talk about one without the other, right? And we can't really talk about food insecurity for any of these populations without talking about wages. But since this is taking a labor framework, that's what I'm going to continue to focus on. So the first is, of course, raising the minimum wage, which is a fight that's gotten actually much more traction over the past several years. Many of you, I'm sure, have heard of the Fight for 15, which was specifically a campaign started by fast food workers in New York City and across the nation. And there's actually been some success. So, the question here is about local, state, or federal response. And I think something I talk a lot about with my students right now is while the federal government might not be focused on improving these issues currently, we can still look at improvements happening at the local and state level. And so the push to increase the minimum wage has been successful in cities like Seattle, New York City, San Francisco, and then the entire states of California and New York have committed to raising the minimum wage to 15 at incremental stages. And then at the federal level, we have the Raise the Wage Act, which was passed by the House, but not by the Senate. But of course, with changing, control over politics, potentially this could be done. There is momentum there and there is will there to make these changes. So that the Raise the Wage Act would amend our Fair Labor Standards Act, which hasn't been amended since 1938, to increase the federal minimum wage of regular employees. In other ways, so I'm one to argue more strongly that we need to make these at a legislative level, but of course, while that is lacking, it is good to see companies committing to this. So McDonald's and Walmart, while certainly it's not because they wanted to, but because the pressure was so strong, have also committed to paying people above the minimum wage. And then we have the tipped wage. So the service workers are the largest percentage of food workers in the country. It's a huge industry. Obviously, as we know, service workers are really hurting right now as they've lost their work. But even before that, they were very vulnerable workers. And so the tipped wage is something that's been very controversial for decades. And so if you don't know, the federal tipped wage has not gone above $2.13 an hour since the 80s. And while many states have a higher tipped wage, what that means is you still need to make your money through tips, which leaves workers vulnerable to things like sexual harassment, to stolen wages by their employer, and to just not making the minimum wage. So this has been abolished at the state level in 7 different states: California, Alaska, Minnesota, among others. And again, this is a way to increase the economic stability of workers and decrease food insecurity. Right, and of course, this is not just in the moment of COVID, but I think we're just becoming more aware of these vulnerabilities, particularly of service workers, as they're just losing their jobs and don't know when they're going to get to go back. And of course, didn't have a economic safety net to begin with to cope with this emergency. And then finally, as I mentioned, assuring that essential workers actually have basic economic and legal protections. And I did actually put links to 2 different, someone requested the New York Times piece. There are actually 2 different New York Times pieces I was referring to, and I linked to both of them. The argument to make essential workers, to recognize that essential workers, so many of them are undocumented, and how do we address that, or that we should address that. So as far as what has been done, again, these are things that there's been progress made, but not finalized due to the current political state of the nation. But in December, the House of Representatives passed the Farm Worker Modernization Act. And while there's many other problematic things in that act, it included a path to citizenship for farm workers. And so, of course, it has not been passed fully by the Senate. So it has not gone into, not become legislation. It puts forward an idea that we could extend a path to legalization for any worker that it's deemed an essential worker right now. So of course that has to happen at the federal level. So those are just some ideas of things that have been making progress that I would hope that seeing this crisis in the food system and this awareness of the importance of these essential workers, the vulnerability of these essential workers, could be a moment to further push for these reforms. And again, it's important to remember, while no matter what happens in the White House, we still have states that are willing to make these changes. And New York State has been one of those places where we've seen changes happen, especially in the past year for farm workers. So we don't have to just think if we don't get the federal change that would be more amenable to supporting workers, that there's nothing to be done. Things can happen at the local and the state level as well. Thank you.
All right, that was amazing again. And so thank you very much. We'll move on to the last question. The last question ties us back into the framework with which we've been working this whole time, which is the human right to adequate food and nutrition. And so the 4th question is, would a legal framework in the United States that mandated a right to adequate food and nutrition improve your ability to address the food security needs of the community of people with which you work? And this would be in general or during a crisis. And again, we'll start with Rachel Murphy.
Thank you, Rick. Yes, and I emphatically say yes. I believe it should start with implementing universal school meals to provide free school meals to every student without demanding proof of income. It really should never be a question if a child is considered poor enough to deserve receiving food at school. We already know the data is there. Studies show that students with access to free breakfast have improved attendance and better performance in schools. Other studies show that children with access to universal meals have improved health outcomes. Teachers and administrators, they see fewer behavioral incidents and lower suspension rates. We really need to get rid of the redundant paperwork for proof of income and viewing food as a privilege, especially in regard to children. Reforming the school meal programs, allowing maximum flexibilities, and expanding the overly regulated meal patterns so we can provide food for all children, regardless of race or creed, so our kids can eat during compulsory education service as part of their education, I believe should be done. And I can't say enough that universal meals should definitely be implemented nationwide. Feeding our children, the next generation, is a basic human need that we can and should meet no matter what walk of life that they come from.
Sorry, I hit the wrong button there. Thank you very much. So we'll move on to Chaya Charles for question number 4.
Okay, in terms of a right to food and nutrition for our seniors, I've already spoken to the funding needs and that we need to make sure that we are funding these programs appropriately. Another big thing when we talk about seniors is that this is not simply a food assistance program. This is also an opportunity for seniors to socialize. We do surveys every year that ask various questions of our clients, and the amount of people that say that their meal delivery driver is the only person that ever visits them is staggering and sad. Also, our congregate meal centers are places where seniors can go and interact with other seniors. They may not have that otherwise. We are well aware of the physical and mental health benefits of socializing and not being isolated. So these programs provide an outlet for that as well as for proper nutrition. I think also remembering that adequate food does not mean adequate nutrition. So adequate nutrition means we are meeting protein, vitamin, and mineral requirements of seniors. A $20 SNAP benefit per month does not accomplish that. And so we need to look at that we're feeding seniors properly. Also, our pantry foods tend to be staple foods, but don't necessarily provide the variety that we are hoping that our seniors are consuming. So looking at ways for them to get the fruits and vegetables and get some of those healthier items. Another thing that I put on here is that living near a farm does not mean you have enough food, but maybe it could. And common sense, if you just think about that, if you live next door to a farm, and I've seen this, people who live next door to a farm and yet they're hungry, common sense would tell you that that makes no sense. And so if COVID did nothing but, let's look at a silver lining and say that it is making us relook at the entire food system in the way that we are allocating resources. And can we please look at that in a way that benefits local communities as well as the people living in them from business and an individual standpoint. Take the opportunity to revamp the system and look at some of those non-traditional procurement methods that we have had to implement during this crisis, and why couldn't those be long-term? And then also just the ability to age in place. Another thing that we ask on that survey is, what would you do if you didn't receive home delivered meals? And there is a shocking number of people that say, I would have to go into a nursing home. So food security should not be the reason that someone has to leave their home and enter an institutionalized setting. If there are other physical and medical issues going on, then that's a different story. But the fact that just because someone wouldn't be able to eat and therefore they have to enter a long-term care facility, when we're talking about human rights, the ability to age in your own home, I think falls right in line with that. To quote Nelson Mandela, he once said, overcoming poverty is not a gesture of charity. It is the protection of a fundamental human right, the right to dignity and a decent life. And I feel that food security absolutely fits that same definition. Thank you.
Okay, thank you, Chaya. And now we'll go to Laura Ann.
Thank you. It's nice to follow both of those comments. I really appreciate what was just said in response to this question. And so what I would add, just to follow up is that from a food system and food labor standpoint, that we need to be looking at food insecurity as, again, directly related to this larger food system. And so until we stop isolating food insecurity and start incorporating it into larger demands for human rights, living wages, rights for undocumented people, we're not really going to see improvement in many of these sectors. And there are, of course, overlaps between both the school-age child population, the elderly population, and the population that I'm talking about. And so I highlight again here that so much of our food system labor is done by women and by people of color. And because of that, this labor has been devalued for forever, right? Food work is not something that's largely seen as high wage work. And that's partially because of how we perceive food work, right? Whether it's working in the fields or whether it's serving in a restaurant or serving lunch to kids at schools. because of the nature of the work, because of who does this work, it's been largely undervalued and underpaid, despite the fact that much of it is very much skilled labor. And so I think taking a human rights approach really gives us this broader framework, and taking a food justice approach gives us a broader framework to understand food security as connected to all these other rights that people should have: a right to fair housing, a right to clean water, a right to decent wages. And so human rights is a broader analysis of all of this, rather than just saying food insecurity as an isolated issue. So yes, it absolutely, I think, helps us broaden our understanding. What I would say is oftentimes, and this has happened a lot in the food justice movement, wages are not tied to food justice, and food labor is not thought about. And I will say I think that's changing as racial justice becomes a bigger part of the food movement. Labor and wages are becoming a bigger part of that conversation, and we need to keep pushing on that. So I'll end it there. Thank you so much, and we look forward to questions if we have any time.
Well, we should, but first, let me thank all of you for your insights and intelligence and passion, and we really appreciated it. And I just thought all the presentations were spot on and just what we were looking for. Before we move to questions, we want to have Dr. Bellows, Ani, to come back in and reintroduce the framework and give us kind of a wrap up and summary of where we are at this point. What have we learned? How does it all fit together? She'll do that briefly, and then we'll we'll go into questions. Okay, so Ani, are you there?
Yeah, I am. Okay. Unmuted. Thank you all. And thanks for the wonderful presentations. I want to make 4 points that seem to have come up. The first is that food insecurity is associated with chronic poverty, structural discrimination, and inadequate wages. That one of the first obligations of states under human rights law is non-discrimination. Food security is not new. COVID has magnified the inequalities, the social inequalities in our system. The second point is the US experiences a contradiction that is found around the world, which is that those who grow, process, and retail, serve food are the most food insecure, especially rural workers, and especially women and children among them. This contradiction is magnified under COVID. The third point is that, as we've heard, being food and nutrition secure is much more than having enough food. It includes improved health status overall, mental well-being, developmental security among infants and children, personal and community autonomy, and perhaps most of all, human dignity. My fourth point is that the panelists point to a hodgepodge and patchwork policy set around food, agriculture, and nutrition that lacks coherence and suggests the need for a national food plan. We need to address high quality, safe, and adequate food for all, seniors as well as children, urban as well as rural populations, everyone across all income spectrum. We need to address structural conditions of food insecurity that include food relief, government programs like school lunch and SNAP, as well as food banks and pantries, but also community development through living wage work, accessible healthcare, revised immigration policy. We need farm policy that prioritizes workers' rights, that prioritizes the production of food that reflects nutritional guidelines instead of maximum yield to the kind of products, cheap meats and corn syrup at the heart of chronic disease. And finally, farm policy that is going to move us towards closer links between producers and consumers. We need a holistic approach that can be represented by a human right to adequate food and nutrition. We need coherence and everyone at the table. Thank you.
So thank you very much. That was perfect. All right, we will go to questions now. We have a few here. The first question is, I guess, directed at Ani, but after Ani responds, any of the panelists would like to weigh in, that's absolutely fine. So the question is, does a human rights approach to food security require universities to address the food security of its students?
Well, a human rights approach requires addressing food security for all. So certainly it can be used to make that argument. What the contours of right to food kinds of plans have to be defined by people whose rights are violated. So, a food security system will not start out and list everything, right, that is included. And we keep learning how to expand and refine what it can be, who it embraces, and that needs to be organized first and foremost by persons who are violated, by being part of policy development. So yes, of course, it includes university students. Thank you.
All right, anyone else on the panel would like to weigh in on that?
I would just say if you're looking specifically at a college and university perspective, I think one of the largest hurdles at this time is that there's a significant percentage of people who don't believe that food insecurity is actually occurring on college campuses, and don't believe that if you have the money to afford to go to an expensive private school, that there's any possibility that you then don't have money for food. I think that's extremely biased. It's assuming that everyone that's going to these private universities is paying full tuition, and that we are trying as a nation to help underprivileged groups get education. And with that comes all the services that are needed to fund and to support those students. And some of that is helping them in the food security realm. So I think that's, from my perspective and in conversations I've had and being involved in our campus food pantry and community garden, that's some of the frustration that I've seen is actual pushback that people don't believe it to be a real thing.
Can I add that I teach an emergency food systems class, and the among the student body, the students don't understand. Privileged students don't understand what less privileged students face, because less privileged students are not going to share that insecurity. And it becomes something that's associated with shame as opposed to demanding a right. And so those who are in a position of food insecurity, whether at the university or elsewhere, are in a position of feeling shame instead of outrage. So there's a lot of work in terms of making it understood that food insecurity is all too alive and well on campus.
Okay, thank you very much. So now we'll go to the next question. At some point, we will shift the slide from the question slide to an information slide with contact information. So anyone who wants CEU credit, which is being given for participation in this Symposium for dietitians, registered dietitians. You can see how to obtain that. Also, all our contact information if you'd like to reach out to any one of us. So the next question is from one of our graduates, Heather Brubaker. Hello, Heather. Missing from the discussion so far is a mention of food banks and food pantries. I'd be curious to know the panelist opinions on the role that these organizations can or should play, not only in, not only in community food security, but also food justice. Thank you. So let's say, why don't we just go through the panelists, starting with Rachel, if you don't mind, if you have an answer for that.
Absolutely, and that's a great point. I know that planning's underway with our team to put together a hunger action plan to help alleviate some of the increases in participation that we expect due to the already foreseen very large unemployment rates that are occurring nationally and locally. What we're thinking is that the strain on the food pantries and other emergency providers that we know is already occurring will continue on post-COVID, and we're trying to look for ways to support our students and families to basically link them into other nutrition services with outside reliable sources of food. Right now, I know there is Nourish New York and some other program and funds that have come through the government to basically increase the amount of product that they're getting. I don't know that that would continue onward post-COVID for very long, but that's something that should be discussed and certainly should be a sustainable change that we look at, is how much are we funding these other programs as we see families and community members at large reaching out for help that perhaps never have. So I think that's a great point to bring up, that, yeah, we definitely need to look at that as a whole.
Jay, would you like to weigh in? Or?
For the seniors that I work with, for many of them, food pantries and actually us providing food pantry food is the complement to our program. Our program only offers lunch and dinner. And so breakfast and any other snack or any other type of food requirements are up to the responsibility of the person. And so when you're talking about people who are highly food insecure, where does that food then come from? Those are the people that I was referring to earlier, that we typically kind of find out on a monthly basis what they need. And we actually are situated right next door to our local food pantry, who is supplied from the Food Bank of Central New York, as well as local donations. And we get our product from them and then kind of deliver that with our meals to seniors. So it's crucial actually to my population.
Lorianne, would you offer some remarks?
Yeah, I haven't worked with food banks or food pantries in the New York region, but I did do research with them in California. And again, as I mentioned, that's really the only option for many food workers that are undocumented. And then at the same time, they run into problems where for undocumented, especially recent immigrants that do the majority of our field work, the food that is being offered in food banks and food pantries is not culturally appropriate. And by that, I don't mean they're being picky eaters. I mean, they've literally never eaten food out of a can before. And they're not accustomed to the selection of the food that's at the food bank. And that's not to disparage any of the work, incredible work being done by food banks and food pantries. But I think it's important to remember cultural differences among these things, that people that are really accustomed to fresh food, getting them food bank food is not always an easy answer. And ultimately, I think from a human rights perspective, right, it's the last resort. It's not what we want to be emphasizing or focusing on. So someone is not, according to the Food and Agriculture Organization, someone's not food secure. This is the basic definition if they're dependent on emergency food. And so I think while it's important to support these essential, institutions, currently we want to, in the long run, find a way to get away from these emergency food systems. And there's been reported kind of the ways that emergency food systems, and Ani could speak to this as well, have just only grown over the past several decades. And again, thinking systematically long-term, we want to be focusing on things like wages and more structural change, so that people we don't have to keep increasing these sources of food for people. So it should really, it used to be that these were emergency stopgap short-term measures, and we haven't been, right, since the 80s, these systems have only grown, which is not a good thing. So yeah, again, not to disparage the work being done there, but I think we want to make sure we don't overly focus on the emergency food options for people.
Can I actually make one other point? If just to make sure that we, or that I am kind of thanking everyone that does help us in our area. In addition to the food pantries and the organized services, the religious communities actually provide a huge support to our people in that they offer a lot of free dinners and their own pantries that support a lot of these seniors, where when they go to church services, they can also take a pantry box home. So religious organizations are also a critical point to helping ensure food security in my population, as well as others that I know of.
Okay, we have one more question, and that is, let's see, based on Chea's discussion with older adults, a person wanted to add, what about working age people who rely on SNAP or food pantries? That is, demographics already under pressure who have now lost their jobs. I guess we did not address that directly, so would panelists like to take that on, including Ani, if you'd like to.
Sure. I mean, I can speak from our program. We saw a large part of the new people signing up for meals were people actually in that demographic that had lost jobs. And when I spoke earlier of the newly food insecure, a lot of people were those people who were working, lost their jobs, and now were food insecure. They were also the people that were visiting the pantry next door to us. And so that was the coping strategies part for them was extremely, extremely difficult because they are in a completely new world, potentially with the stress of the pandemic and maybe homeschooling their children and, you know, all of these different things that were going on. And yeah, now food security was just one extra layer. So we really just tried to ease that process as much as possible, but absolutely they were one of our more, one of the groups that we focused on quite a bit during this.
Anyone else?
I would just add sort of generally, that maybe cross this point in the last question, that from a human rights-based approach, the provision of social protection is critical, is a critical piece. There's all this about building strong, sustainable food economies and communities, but a rights-based approach must include social protection arrangements for people who cannot create food security, food nutrition security for themselves, either because of chronic conditions of poverty or crisis or emergency. I would just leave that there.
Okay.
And that food banks and food pantries, charity forms, are as relevant as government-supported options.
All right. Anyone else from the panel would like to speak to that? We're all worn out. Okay. I don't blame you. It was just wonderful presentations. I do want to say that we will send a link to the participants where they can use to access the cloud recording that we've made of these presentations. And I want to give special thanks to Margaret Voss and Lynn Brand, who were behind the scenes this whole time, helping and making it work. And so that was, without them, it would not have happened. That's not at all an exaggeration. So thank you to the panelists. And I will say one thing I'd like to say in summary is I just thought this was a very good complement complementarity between the nutrition program and the food studies program, and how we worked on these food access and food security and food sovereignty issues, and which we do in our daily work, but here we felt like we got to showcase it. So thank you to everyone, and thank you to the participants who registered and came and listened. And we hope to, if we reach out to us, feel free to reach out to us in the future on any of these issues or collaborations or any questions you have. Anything else anybody would like to say before we sign off? Okay, well, thank you very much. It was a great pleasure.
Thank you.
Thanks, everyone.